Hello YouTube. I hadn't put a video up for quite a while until this morning. I've been sick since last summer actually. I'll tell you what's going on with me, what was going on then, and now it's a whole nother story. I fell out of bed. I had a nightmare. I fell out of bed last early fall, late summer, and I fell right on my stomach. It hurt really bad for like 15-20 seconds, and then the pain quit. I thought I was okay. It turned out that it dislodged my gallbladder and bruised my liver. And I didn't find out really what was going on for a few months. And it became very painful. My stomach area, liver area. And eventually there was a swelling about where my liver is. So I went to the emergency room, and I was admitted. They did all kinds of tests. I was in intensive care for a week, and I ended up having 3 surgeries at that time. When I was, after the surgeries, I spent 3 more weeks in the hospital, so it was a total of 4 weeks. What had happened was when I fell on my stomach, the liver was the bad part. It had bruised it, abscessed. All of that had accumulated in there, and it was just really, it was poisoning my whole body. And the doctor said that if I hadn't gotten to the emergency room when I did, that I probably would have died within 36 hours. So I had 2 surgeries to clean out all of the abscess, and there was even dead tissue in there. And they put a tube for my gallbladder, draining through my stomach, through my abdomen into a bag, and I had to carry that around for a while. The whole time I was in the hospital, and then for a period of time after I come home. And they made a big incision in my right side of my abdomen, and it was a trauma surgeon that did it. Excellent surgeon. He saved my life. It left a big indentation in my stomach area, my abdomen area. And they did a skin graft. That was the 3rd surgery. And then I had the place on my leg to have to heal from where they removed the skin. And they used on my abdomen to help it to close and heal. They used a thing called a vacuum, and then they'd change my wound every other day and use that vacuum on it constantly. And it was pretty painful, but depending on who did all that, whether how painful it was. So the ones that were really good at it and didn't cause a lot of pain are the ones I always ask for. So I went into the hospital on the Monday after Thanksgiving, and I was released on Christmas Eve. They wanted me to go to a rehab therapy center, and I said no, I just wanted to come home. So I come home, and my husband was here, and he was a great help. I couldn't get up and down out of the chair by myself. I couldn't lay in the bed and sleep. I had to sleep sitting up. And but eventually, you know, I got stronger, could walk better, got really good. And then on May the 1st, I had my gallbladder taken out. I had a huge gallstone, and I'll tell you, I have felt a world of difference since I had the gallbladder taken out. I just feel so much better. So I didn't realize a gallbladder could be so, not necessarily painful, but just caused me a lot of not feeling good. So I'm glad that thing's gone. Anyway, I had that done the 1st of May. The first part of June, I felt a lump in my breast. So I went to my family doctor. He ordered a mammogram and a ultrasound, and they sent me to a doctor at the cancer center, and he did a biopsy, and they found abnormal cells, which he classifies as cancer. Okay, I had a nurse practitioner say later that just because it's abnormal cells does not necessarily mean it's cancer. So I don't know. Anyway, my breast is swollen quite a bit, and it's warm to the touch. It was quite sore, and it's not as sore now. I went to an oncologist a couple of weeks ago, and she said that she wanted to put me on antibiotics because of, she wasn't sure that it wasn't just some inflammation of the glands in my breast. So I've been on the antibiotics, almost finished now. They did help a couple of other things for sure. I had a infection on one of my tear ducts on my left eye, and it took care of that, made that better, and my right ear was giving me problems and very sore, and that all got better. So I don't know whether the antibiotics have helped my breast or not, but they helped the other things. So tomorrow I go for an echocardiogram on my heart because they had discussed chemotherapy for me before surgery to reduce the size of the lump. And the chemo, some of the forms of chemo is hard on a person's heart. Well, all 4 of my valves on my heart have a backflow. They don't close completely. And it sometimes I can go into arrhythmia, which I did when I had my first surgery when I was in the hospital in December. And also, my whole body was out of whack at that time, so they even put me on dialysis for a couple of times. And the second time, I went into arrhythmia on it. So the oncologist wants to check my heart out to make sure, that I would be able to do the chemotherapy that she's thinking of. So and then next week on Tuesday, I go have a PET scan, which is they mix sugar and a chemical, put it in my body, and the whole process takes 2 hours. And the sugar goes to any area in my whole body that might have cancer cells. So the day before, I'm not supposed to eat any carbs, and from midnight on, I'm not supposed to eat or drink anything. And after I have the PET scan done, then I go to talk to the oncologist again. So I'm not really sure what to think of all this. I mean, why did I go through all this stuff back in December and January and recover so well and then be faced with possibly breast cancer? I don't know. Sometimes I feel a little down and depressed, but for the most part, I'm still pretty optimistic, because I'm still hoping that it is just an infection and not really cancer. Because I feel so good. I mean, I'm getting jobs done here around the house that I've been wanting to do. I've been doing crafts. I've been cleaning. I've been just doing all kinds of things that I used to feel so bad, and which a lot of that I attribute to the gallbladder thing, but I would think if I had cancer I'd feel a lot worse. I don't know. But I'm not sure what to expect from the whole thing. I'm trying to stay optimistic because I know that kind of frame of mind is the way you should be, because if you feel like you're going to be sick, you're going to be sick. So I'll keep everybody posted. Maybe there's somebody out there that's interested. But I just thought I'd catch everybody up because I haven't posted anything for so long. And I'll continue to make posts because, like I said, I've been doing lots of things. Got lots of beautiful flowers in bloom. I'm sitting on my back porch right now, and what you're looking at is my water garden. So I'll give complete videos of all the different things that I've been doing. So thank you for listening, and I appreciate it. Talk to you later. Bye-bye. I couldn't resist. This little fellow lit on my flowers, and he's just enjoying himself. This is one of the joys of life, being able to sit on my back porch and watch these beautiful birds.